So CAR T cell therapy constitute nowadays a curative treatment strategy for patients basically with B-cell non-Hodgkin lymphoma, not only in third line or plus, but also in second line. So we have two constructs that have been approved, basically Axi-cel and Lysocabtagene, to treat patients with primary refractory and early relapse diffuse large B-cell lymphoma. And we have other constructs that have been approved also for follicular lymphoma, for mantle cell lymphoma, and of course for aggressive B-cell lymphoma in later lines of therapy. So even if they are considered a curative approach and they are gaining more and more space in the treatment of these diseases, they represent logistical challenges. And I would say that these logistical challenges are kind of multifactorial. First of all, referral of patients needs to be optimized. We don't have so many centers that have been approved or that have the possibility to treat patients with CAR T, and many of these patients are being treated in smaller centers or centers that are not don't have the capacity to treat patients with CAR T. So referring patients on time with the adequate performance status, I would say that is one of the most important things. Then we have to fight against logistics and all the approval processes once a patient has been identified as a potential candidate to receive CAR T. And of course, we have to fight against the long manufacturing processes that autologous CAR T cell constructs have. So since or from the time that we identify a patient as a potential candidate to receive CAR T, by the time that this patient can be infused, depending a little bit of the countries, and of course depending or a little bit different between US and Europe, where in US the process is significantly quicker than in Europe. We have a time interval between 4 to 6 weeks in which we have to have the patient in good performance status and with the disease with a little bit of control to be able to take the patient in good conditions to CAR T. And we know from a real world evidence analysis that around 50 to 55% of the patients eventually don't make it, a little bit different from one country to the other one, and of course different from one disease to the other one. So still we need to work on all these challenges.